Hi, my name is Miriam, and I'm going to be the student nurse for today, and I'm going to be administering insulin. So, first thing I'm going to do, I'm going to integrate my patient identity, and then I'm going to do make sure when I do the appropriate body mechanics, and then I'm going to start with my fast check, which I'm going to check the medication on the MAR, and the medication I have to administer today is insulin, and it's regular insulin, 58 units subcutaneous, and it's 8 o'clock. My patient's name is Jan Doe. The date of birth is 1/23/27. So for this, I have to make sure that I have the right patient identifier, right route, right dosage, right time, oh, do perfect documentation and check for any allergic reaction. And the next thing I'm going to do is select the syringe and the needle. So the syringe I have here, it's going to be the 100 ml because the patient is receiving 58 units of insulin. So this is the 100 ml. And I also prepared my stuff here. I have my needle container here to put it for disposal, the red container, and I also have the alcohol swabs, and I have the gloves, and that's going to be where I'm going to be doing my demonstration. So to begin with, um, already assembled my syringe, the stuff that I'm going to need, make sure everything is sterile, and then I'm going to do my second check. My second check, I'm going to make sure I check for correct patient identifier, right dosage, right time, right route. Um, Make sure I check the expiration date on the medication. Okay, it's 2024, and it's the right medication, right dosage, right route, right patient, and also I'm going to check also for the allergic reaction as well. And then I'm going to make sure I do my calculation for the medication before I give it out. So the next thing I'm going to do, I'm going to look into the vial. So this is the vial I'm going to be using. So from here, I'm going to put my gloves on. I already had washed my hands prior. Make sure everything is sterile. So I make sure everything is sterile. So I'm gonna use alcohol to clean off the top. I take the top off. So I do it for 15 seconds. Toss that away. And then take the injection off. Take the cap off. I'm gonna put air in it, 58 units of air in it. Alright, there you go. And then I'm gonna inject it into the vial. And then I'm gonna take out 58 units. If there's any bubbles that I get into the syringe, I have to redo the procedure again to get rid of the bubbles. checking for the bubbles. There's no bubbles. And then I'm going to recap it. And then after this part, I'm gonna go into my patient room and then do the my third check in my patient room, and then I'm gonna select the body part. I'm gonna do the injection. For me right now, I'm gonna do the injection in the abdominal area for my client. So I'm gonna bring in my client.
Coming.
Hi, my name is Miriam, and I'm gonna be a nurse for today. What's your name?
Jendo.
What's your date of birth?
1/23/27.
Okay, let me confirm that. Okay, Jendel. So I'm gonna provide you privacy. Are you sitting properly? Are you comfortable where you are?
Yes, ma'am.
I'm gonna do that, and I'm gonna do good body mechanics. So the next thing I'm gonna do, I'm gonna check. I'm gonna do my third check. I already identify this is the correct patient. Use the two identifier for the patient, the date of birth, and the name. So the next thing I'm going to check is for the right confirm for the right medication, right route, right dosage. And do you have any allergic reaction to the medication that I'm giving you?
No, ma'am.
Okay. Also, I'm going to do the correct documentation. And so right route, right dosage, right time, dosage time, route, documentation, do the right documentation. Okay, so so here I already washed my hands prior, and I already have my gloves on. So I'm gonna identify the correct sites to give the injection. So for this patient, before I do that, I'm gonna check my patient blood sugar, because I know when you're doing an insulin shot, you just don't go and give an insulin shot. You have to check for the blood sugar, and then give the insulin shot. For this, and for now, I'm gonna be giving the insulin shot. So I'm gonna identify the area that I'm gonna do my shot. So I can either do it in the arm, in the back, in the thighs, or the stomach. So for this patient, I'm going to do it in the stomach. And in the stomach, she's a thick patient, so I'm going to use the 90-degree. So for that, I'm going to I have my medication over here prepared. I'll put this here. So I'm going to take the alcohol swabs. I already found the site that I'm going to do it. Which is the stomach. So in the stomach, can I see it? So I'm going to do it in the stomach. So in the stomach, I have to do it away from the belly button. And then that I'm going to demonstrate that over here. On this little skin body here. So I'm gonna put the alcohol, thank you, on a circular motion. Okay, and then I'm gonna dispose that in the Shaps container. And then I'm gonna get my injection, and then I'm gonna remove the cup. So I'm gonna be giving it at a 90, bend it over a little bit, on a 90 degrees angle. So what I'm gonna do, I'm gonna pinch the skin, because my patient is pinch it at least, and then put the injection directly into the skin straight at a 90 degrees angle. So I'm going to put it in slowly into 90 degrees angle and then release it slowly, at least 10 seconds. And then after that, I take it out the same way I put it in. And then I'm going to put safety in this. And then I'm going to throw it in the shop's container. And then I'm going to use alcohol swab again. This time I'm just going to do a little dubbing. So the next thing I'm going to do, I'm going to make sure I do the right documentation. Make sure my client is, are you comfortable? All right, and then before leaving the room, I'm gonna wash my hands and take my gloves off. Let me take my gloves off first. And then wash my hands. Wash my hands. And then make sure I do my right documentation, my client is safe, and I think I'm good as long as my patient is good. The procedure is done.